Welcome back to our new session of liver cirrhosis. Today we are going to discuss about its signs and symptoms. As we have discussed earlier, liver cirrhosis is actually a disease which is associated with repeated injury to liver tissue, which in turn leads to inflammation. These inflammation changes will lead into the healing process and formation of fibrotic tissue. The process by which these fibrotic tissues are formed will eventually lead into a stage where the liver stops functioning in the normal cells, and this is what we call as liver cirrhosis. Today we are going to discuss about the signs and symptoms associated with liver cirrhosis. Now, discussing about the signs and symptoms of liver cirrhosis, the most important thing is to understand that these signs and symptoms are not that which are associated only with liver cirrhosis, but these signs and symptoms can also be associated with certain other diseases. But presence or absence of a particular sign and symptom is not confirmatory that it is occurred only due to liver cirrhosis, but it can be present due to presence of some other disease also. So we have a long list of signs and symptoms, and we will discuss one by one that what are their importance and how do these signs and symptoms appear. The first sign is spider angiometer, also known as spider nevi. What is this? This is actually a dermatological appearance where centrally an arteriole is present surrounded by many small vessels, and it gives an appearance of a spider. So is the name. So it is a vascular lesion, as I said, because it has a central arteriole associated with certain small vessels due to increase in estradiol, which is a hormone. Next is palmar erythema, exaggeration of normal speckled mottling in the palm. There is a red colored appearance due to altered sex hormone metabolism. Next is gynecomastia. This is a strange phenomenon which occurs in male. That is, they have an appearance of a breast growing on their chest. It is a benign folliculation of glandular tissue of male breast, that is known as gynecomastia, presenting with a rubbery and firm mass extending concentrically from the nipples. This is due to increase in estradiol and can occur up to 66% of patients. So gynecomastia in males is very uncommon, and as you can see how gynecomastia is developed in patients of liver cirrhosis. Next is hypogonadism, manifested as impotency, infertility, loss of sexual drive, and testicular atrophy due to primary gonadal injury or suppression of hypothalamic or pituitary function. Now, in these cases, liver size can be enlarged, normal, or shrunken. Splenomegaly is one of the other findings that we will find in liver cirrhosis. Increase in the size of spleen is known as splenomegaly. You can also relate the term hepatomegaly. Hepatomegaly means increase in the size of liver due to congestion of red pulp as a result of portal hypertension. We will discuss portal hypertension later. Other symptom which appears in this series is ascites. Ascites is accumulation of fluid in the abdomen. Accumulation of fluid in the peritoneal cavity giving rise to flank dullness. Needs about 1500 ml to detect the flank dullness. Flank dullness is a physical examination which is done to assert the presence of ascites. It may be associated with hydrocele, that is accumulation of fluid in scrotum, and penile inflammation, swelling of the penile shaft in men. Then the other finding is caput medusa. In portal hypertension, the umbilical vein may open, blood from the portal venous system may be shunted through the periumbilical vein into the umbilical vein and ultimately to the abdominal wall vein, manifesting a capita medusa. This is an appearance, it appears as a sign that it is a swollen part can be seen around the umbilical region. Why is this occurring? This is occurring due to the portal hypertension. Why does portal hypertension develop? You can blame the fibrotic tissue present in the liver, which is creating portal hypertension. This portal hypertension, the umbilical vein will open and it will let its blood in the periumbilical vein and route into the umbilical vein, which gives an appearance of caput medusa. Then the next sign that appears is curvular pulmonal murmur. Venous hum heard in epigastric region on examination by stethoscope due to collateral connections between portal system and the remnant of umbilical vein in portal hypertension. This hum sound can be heard with the use of a stethoscope in the periumbilical region. Fetal hepatitis, musty or odor in breath due to increased dimethyl sulfide. It is a pungent smell that you can experience in the breath of the patient suffering from liver cirrhosis. This is a musty odor, and this is due to the presence of dimethyl sulfide. Also, you can find certain symptoms of jaundice. Yellow discoloration of skin, eye, that is particularly the sclera, and mucous membrane due to increased bilirubin, at least 2 to 3 milligrams or 30 millimoles per liter. Urine may also appear dark due to presence of urobilinogen. And step 6, bilateral asynchronous flapping of outstretched dorsiflex hands seen in patients with hepatic encephalopathy. This is a sign. The sign is something like this. The flapping of hand is an involuntary flapping of hand. Others can be like weakness, fatigue, anorexia, and weight loss. Other changes can also be enumerated as the nail changes. Murex nail, paired horizontal band separated by normal color due to hypoalbuminemia, low production of albumin. That is, you can see a paired horizontal band which is appearing on the nail and is separated by the normal color. So you can see bands of different colors present on the nail. Then you have Terry's nail, proximal 2/3 of the nail, proximal, that is proximal to the nail bed of the nail plate appears white with distal 1/3 is red, also due to hypoalbuminemia. So the proximal 2/3 of the nail will appear white, whereas the distal 1/3 will appear red. Then you have clubbing. Angle between the nail plate and the proximal nail fold is more than 180 degrees. You can find the clubbing of nail by putting both of your nails in this fashion, and you will find that there is an angle between these nails has increased more than 180 degrees. So you can easily find out whether the clubbing is there or not. Then other changes is hypertrophic osteoarthropathy. Chronic proliferative periosteitis of the long bone that can cause considerable pain. So what we can have is, you can have pain in joints, various long bone joints will give you pain. Uterine contraction is another finding. Thickening and shortening of palmar fascia that leads to flexion, deformities of finger. Thought to be due to fibroblastic proliferation and disordered collagen deposition. It is relatively common in 33% of patients. This is an appearance of ascites, of how ascitic abdomen looks like. You can see there is a swelling in the abdominal region which is so profound that the umbilical has protruded out. I think so it would be difficult for you to recognize that a spider angioma is present, but you can see here central esophageal and arteriole is there, and the various small vessels are protruding out of it, which is appears as spider angioma. Gynecomastia, this is the male. You can see the presence of breast developing in male, and this gynecomastia is present in cirrhosis, but gynecomastia can be present in other diseases also. Now we come to the diagnostic part. The gold standard of diagnosis of liver is cirrhosis is liver biopsy. The gold standard means it is the confirmatory test which will give you a thorough knowledge that whether the liver is suffering from liver cirrhosis or not. Other tests apart from this can only be indicative of liver cirrhosis, but liver biopsy will give you 100% confirmation that it is liver cirrhosis. So the gold standard term is used where the confirmatory test, a particular test is known as the confirmatory test, and we say it's the gold standard. Histologically, cirrhosis can be classified as micronodular, macronodular, or mixed. But this classification has been abandoned since it is non-specific to its etiology. The appearance of a liver on biopsy, whether the nodules formed are macro in size or micro in size. But this appearance has nothing to do with the etiology. So we don't emphasize too much on the histological appearance. Now the other laboratory findings. As we have seen, we have gone through the liver function test. So obviously we will be running a liver function test. So SGOT and SGPT level would be elevated, where SGOT level would be rather more elevated than the SGPT level. However, normal levels cannot be found in cirrhosis. Then comes the alkaline phosphatase, which is slightly elevated. GGTP correlates with alkaline phosphatase level, typically much higher in chronic liver disease from alcohol. Bilirubin may elevate as cirrhosis progresses. Albumin level falls and the synthesis process is hampered. Then we have also discussed about the prothrombin time as increases due to the liver synthesizing increases the level of prothrombin. Globulin increases due to shunting of bacterial antigen away from liver to lymphoid tissue. Serum sodium hyponatremia, that is decreased quantity of sodium, may be found. Thrombocytopenia due to both, that is deficiency of thrombocytes, both due to congestive splenomegaly as well as decrease in the prothrombin. Leukopenia and neutropenia due to splenomegaly and splenic margination, and copulation defect can also be found. Other laboratory studies performed in a newly diagnosed cirrhotic patient, you can go for the serology to find out whether any hepatic virus is involved or not. You can also go for the ferritin and transferrin saturation, immunological levels for any autoimmune disease, cholesterol and glucose level, and also the alpha-1 antitrypsin. You can confirm these according to the etiology that we have studied. Then you can have some imaging techniques like ultrasonography, gastroscopy, MRI scan. So these are some of the tests that you can run to diagnose liver cirrhosis. Thank you for today. In the next class, we will continue with the complications of liver cirrhosis.